I'm so glad you got a chance to come back, and we got some of the results back. And after looking at everything, I think, to be honest with you, that it's probably wise to undergo a biopsy and truly find out what we have. There is no doubt that everything else we've done so far is indicative, but the only way you can ever be sure whether we have cancer or not and what kind it is by actually taking the biopsy samples, sending that to pathology, have them look under a microscope, and then they can tell us for sure, is it, a low risk, is it a moderate risk, is it a high risk? And the reason for that, the reason why that is important is because we never want to either over-treat somebody nor under-treat somebody. I think we always want to do what's, the right amount of pressure for the right situation. My grandmother was really cute. She says, don't let the cure be worse than the disease. And she was totally right. Very wise woman. The traditional way of doing prostate biopsies is to do an ultrasound of the prostate. You can look at, the size of the prostate, which later can help you determine the density more accurately that we had talked about before. It also helps you, make sure you're taking samples from different aspects of the prostate. And in some occasions, you can see some, definitive areas that will look different. They will have a different kind of shadowing that can point to an area that deserves more attention. But usually when we do biopsies like that, they're called random biopsies, okay? And what we do in that case is we have the prostate, there we go, and we divide it, and usually, depending on the size of the prostate, it can range from 12 to 18 biopsies. The smaller the prostate, the less number of biopsies. The bigger the prostate, you sometimes have to add a few more. And so what we do is we divide the prostate into 12 regions. We'll just do the general one. And you take a little sample of each one. Okay, and that would be cross-section. If you were to do this, just to kind of give you an idea, lateral, then the biopsies look a little bit longer, okay? And so a biopsy is kind of thin, but it's long, all right? And this is the urethra going through here, and this is your bladder there. And then if you go more lateral, meaning, think of the prostate as an egg in a way. As you're coming further along from the sides, it gets smaller, you do some more biopsies. But when you look at this, even though it looks like a lot of biopsies, primarily when you're at the receiving end of it, okay, believe it or not, yeah, we only sample 1 to 2% of the total volume of that prostate, which, if you think about that, that's not very much.